You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for a successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast, and I'm thrilled to interview my next guest because I've seen her all over the place for many years now, and we have connected once already to familiarise ourselves on her wonderful product, and I would like to welcome her as a guest right now, Dr. Padma Gadiyar of Smilo.ai. Welcome.
Thank you, Julie. Thank you for having me. It's a great privilege to be on your show.
Oh, you're very kind. Thank you. Before we get into Smilo.ai, can you just give us a bit of a rundown of your career to date?
I started as an overseas dentist. I graduated in India, migrated here following my husband, building a dream in an overseas country. We started young and came to Australia, had to do my ADC exams. During that phase of doing my exams, I even worked as a dental assistant, sterilization assistant, learned a lot of admin work. So, I have a very affectionate relationship with my team members because I know the bits and pieces of their work. I've been there, done that. I know how it is. And then I moved into practice ownership, and then into multi-site practice ownership. We also do own medical centers and cosmetic centers. Then got into writing a book on practice ownership, and
Fantastic.
then consulting exclusively on exit and entry planning for dentists.
Tremendous. Now, your husband's a GP as well,
Yes,
which is why you've got ownership over both medical and dental practices, and you've got multiple dental practices, you said?
yes.
And because you've had that behind the scenes experience as a dental assistant, I'm sure your approach to that team management is quite a bit different.
Absolutely. And look, I understand they are humans too. Of course, we have a lot of expectation from our team members that they have to have the phone conversations right. They have to give the patients the right experience. They have to maintain the metrics for us. They have to maintain the retention rates. They have to be fully alert all the 8 or 9 hours they're working there, maintain the high level of compliance, sterilization, four-handed dentistry. Come on, they are humans too. And in my experience, if you want to go faster, go alone. But if you want to be a long-time player, you want to build an empire, you want to build a legacy, you have to have a really good team supporting you all throughout the journey. And that lesson I learned from a very young age. I come from a business family myself, whether it was my own practice ownership or about getting into consulting or now into technology. Team is the most important asset in your business.
It really is. It's nice for you to hear that from you as well. I've read a few books from retired dentists that have been written by retired dentists, and one of the common themes is, I just wish it took me a shorter period of time to learn how to interact and get the best out of my team. And I know that Dr. Jesse Green says on his magnificent podcast, the Savvy Dentist podcast, he has said on a regular basis, and I completely agree with him, that he's never come across a staff member that wants to turn up to work and do a bad job.
Absolutely.
We all want to do a good job. And so let's start being curious about what we all need in order to get that good job coming out from us.
Absolutely. And we are talking about performance evaluation and training. I have quite a little bit of a different approach there. I'd rather go and ask them where they are at, what is their understanding, so I can help them from where they are at to reach the potential I want them to reach. Because if I don't know where they think they are and where I think they are, and there is a communication gap there of understanding, then the problem starts arising between the practice owner and the team member. So
Absolutely.
for me, that performance evaluation is done slightly differently, that I have to understand what is their understanding about themselves first before I give them an opinion about what I see, right? So
we need to know where the starting point is, don't we?
Yes. And I believe in open communication. And it could be our fault as practice owners as well, that we have a higher expectation and a lower level of training that we are providing. Sometimes it's just good to just sit and relax and have a performance evaluation. Tell me where I could improve as a practice owner as well.
Oh, I love that question. It's magnificent. And just, we're not concentrating on this. It sounds like I should get you back on as a guest again to talk about team dynamics.
Sure.
But there's a lovely phrase that I learned from Dr. Gabor Mate. He's a Hungarian, I think, psychotherapist or psychoanalyst. And he rolls out this term in a completely different way, but I just like the two words together, because I think it's a wonderful way to approach discussions, not just with team members, but even with patients as well. But when you want to develop that frank communication, that safe communication, this lovely term of compassionate inquiry. Does it sound good? So you come in from a place of compassion, just inquiring about where that other person is right now.
Absolutely. And look, everybody has their own experiences from the past, present. We want everybody, including us, to detach ourselves when we enter the room, when we enter the practice. All the time, that's not possible. They have their family, they have their personal, they have their mental health issues, a lot of things going on, health issues. We have to be considerate and compassionate to our team. And over the last 12 to 18 months, Julie, you've been extensively consulting in the dental industry. You are much ahead to what my understanding is. But one common thing every dental practice owner's heartache at the moment is there is a high staff turnover. We do not have enough team members coming to work. There's a huge demand for dental work, but we are busy, but actually we're not running to our potential because of the lack of trained team members.
It's a big issue. I've heard from podcasts from other countries. It's a big issue in the US and it's a big issue in the UK as well. And I think it really forces us to the opportunity of reassessing how we do it here. What environment are we creating for them? What are all the points that make it a wonderful industry to be a part of? Because I've personally loved it for the whole period of time the past 34 years that I've been part of it. And I've had very many roles. A lot of people think, oh, it's a bit of a dead end job and things like that. No. I think dentistry can be anything you want to make it. And there's various different dental practices that offer quite diverse opportunities for their employees as well. So
Absolutely.
we need to start recruiting new blood into that pool, don't we?
And with the new blood coming in, we'll also have to adopt some changes. They are used to digitalization. They are used to convenience. They are used to quick way of working. A lot of dental practices have to still equip themselves to that steadiness, that readiness, and that digital aspect that these new team members will be looking for.
Yeah. Oh, gosh, I've got more things to talk to you about that, but I am aware of our time. I'm going to get you back on again if that's okay with you to talk about this very topic. I think it's pertinent. So fast forward through your career and you started to get much more interested in the AI possibilities within the dental industry. What was your first exposure to that? And then we'll talk about what Smilo.ai actually offers the industry.
Look, my first exposure to AI was in the Silicon Valley when I saw what it was doing in the retail sector. Knowingly or unknowingly, Julie, we have all been exposed to AI for the last few years, whether it's the banking industry, whether it is fintech, whether it is retail, the checkouts at Woolworths and Coles, directly or indirectly, some form of artificial intelligence or augmented intelligence that people want to call it has been a part of our life. People have been experimenting it, and especially in the healthcare sector, in the radiology space, it's taking a huge boom. That's when it started. It started taking my. I started noticing it. I started getting more and more curious, and I was looking at how different aspects of healthcare, whether it was telehealth, whether it was radiology, whether it was pathology, how they were using artificial intelligence, and more and more research went into it. And that's when I said, but these people are doing a lot of AI to help us as a decision making tool. We as dentists are trained already in a lot of these kind of things. Of course, repetitiveness can be much better with artificial intelligence, but we are trained in this. What is actually missing in this entire loop is a patient facing stuff where we can educate our patients, and the same thing can educate our staff. So when they are on a phone call, they know they're talking the same kind of a language. Also, as a patient, you're only visiting your dental practice probably a couple of times a year, or maybe once a year, or 47% of the Australian population doesn't even visit the dentist in like 18 to 24 months. So I was like, how can we give them a tool that's readily available? They can constantly monitor their oral health for any small changes and then seek opinion or treatment. And immediately I noticed smartphones, because I said, we don't use watches anymore because it's smartphones. We don't have those telephones at home anymore because we have smartphones. The texting has been all on WhatsApps and Instagrams and Facebook Messenger. We also probably use more of our digital wallets now for card payments or anything. I'm like, I go to shopping without a handbag, but not without my smartphone, right? I probably even go to bed with my smartphone next to me as a reminder, as an alarm. I said, why don't we harness the power of smartphone technology? Heart rates are monitored through our phone connected to our smartphone. I said, why not for dentistry? It's a great
Fantastic.
communication tool. It's a great education and engagement tool. Why don't we use it to our potential? That's the question I asked, and that's where Smilo.ai came into existence from.
Fantastic. And I agree that education and engagement of patient is something that every practitioner and practice challenge is challenged with. So describe what Smilo is.
Smilo.ai is an AI-powered virtual care platform where we take a few mouth selfies. We educate patients on what kind of oral diseases they're going through. We help them remotely monitor it. But the most important fun bit is they can even see how their future smile can look with the click of a button from the comfort of their home, anytime, any place. Dentistry is always associated with high cost or pain, right? Anxiety. We want to make dentistry more approachable, accessible, fun. You know, take that anxiety barrier off, take that cost barrier off. If I have a smartphone, I can get a dental consult,
Fantastic.
and I'm not going to be judged for it. I can do it from the comfort of my home. So that's the essence of Smilo.ai.
It's funny you say the word judged. I just recently wrote an article. It will be published in Australasian Dental Practice magazine in the next couple of months, I imagine. And it was prompted from a post that Angus Pryor, the marketing guy for dental, put in his Facebook feed. And his question was around, why do you attend the dentist regularly? And a lot of the people were saying things like, prevention. Prevention was a very strong theme there, which I was very impressed with. But one person said they were a regular attender for many years, every 6 months, and then was harshly judged by a hygienist and decided not to come back. She said, I was done. And she just stopped coming back because of the fear of judgment. My mother, when all of my career in dental, she's always reiterated how her generation, they did look after their kids before themselves. There wasn't a lot of money around, so a lot of their denticians were neglected, and they feel shame around that, and they don't attend because they feel that level of judgment. I mean, how many patients are we missing out on seeing because they've got emotional stuff, fears and anxieties around turning up in the first place, where this Smilo AI could be that link that actually encourages them to come in for a full formal checkup.
Absolutely. And look, if they have that issue, they can chat with the dentist. There's no obligation or anything. They can chat with the dentist. And for dentists, now they're getting more pre-qualified, pre-triaged, and very well aware and educated patients. Imagine the time it's going to save their treatment coordinator themselves on communication, because now the patient is more curious to know what my options are. How can I take care of my health, right? And they're remotely monitoring them, adding constant value, building loyalty, building engagement. What is the biggest problem apart from staff? It's about getting new patients, having those high value patients, having our regular patients return back for regular checkup and cleans. If you go on to about 8,000 dental practices in Australia, our retention rates are less than 40%. And this is like an industry average, right? So why are we missing out on those opportunities? We already sitting on a pot of gold and we're missing out on those opportunities. I did it too in my practice with full honesty, right? And as you get better and better at practice ownership and business, understand business better, you realize you're constantly investing in getting new patients while you're ignoring on the pot of gold that you're already sitting on.
Oh, for sure, for sure. And what you're talking about with the Smilo.ai as well is that the patients are able to, with your application, take an image or a scan of their mouth and it will give them an indication the health level of their mouth. Is that right?
Yes, look, we are not a diagnostic tool. For diagnosis, as a dentist, I think radiology is very important. And as a dentist for over 12, 14 years now, I understand the importance of radiology. So we're not trying to be a diagnostic tool here. We're trying to be a pre-screening tool here. We're trying to be an education tool here. So when you probably get a patient into the chair, you directly don't go and take X-rays because of the Alara principle. You examine their mouth first. So it is that procedure that we are readily performing through the power of artificial intelligence, smartphone, and computer vision technology.
Tremendous. And what sort of things can that kind of scan pick up?
Look, we have started with dental decay and gum disease because those two are highly prevalent across the world's population. And to give it a zest, we have added the cosmetic bit to it. But in the next 6 months, we're coming up with more interesting stuff that we've achieved from the patient survey, whether it is expanding on our treatment monitoring, whether it is any of the treatment from orthodontics to implants. And even with the identification, we are coming up with more tooth wear and orthodontics.
It's amazing. I find it's so foreign. The concept seems so foreign to me. And I think this is where the gap can be, isn't it? It's, that we think that the world is capable of this much because that's what we're being exposed to. But it's a leap in our minds to go, actually, what is out there and what we're capable of and is quite a bit higher, quite a bit more elegant than what we've thought in the past.
See, the pandemic has made us question the way we always provide, we've always been providing service. Luckily, Australia has not been one of those countries that was heavily affected, right? But virtual care has become a norm in a lot of South Asian countries now, right? And people are used to virtual care now. Everybody is like, oh, why do I have to leave home? I had a chat with one of my design team yesterday, and her question was, Padma, why do I need to go to my dentist for my regular ortho checks? This is getting too boring. I have to get out from my chair, get dressed. I'm working from home, right? So you realize that the trends are changing with especially the Gen X's, the Gen Y's, the Gen Z's. The trends are changing. They don't want to go just for the sake of a check anymore. Right? It's about the fuel cost. It's about getting off work. It's about going there, finding a parking, sitting there in the waiting room. It's a lot of PP cost for the dentist. Time gets wasted. Time could be used for another patient by the dentist. So there's a lot of factors to factor in why a practice needs to start adopting virtual care and telehealth now. If you don't adopt it now, if you adopt it, okay, let's go into like, if you adopt it now, there is a differentiating factor. In the next 4 to 5 years, that's just going to be a norm. AI is going to be part of our life, just like smartphones are.
Yeah.
15 years back, smartphones were not part of our life like it is today. Right?
It is like what we can pick up on these sort of technologies as they come available to us, or we can be forced into it because that's just what the market's demanding now, and it's so prevalent now. And I can see that happening in the coming years.
Absolutely. And the selfie culture, Julie, we've all seen the selfie culture taking the trend there. And patients want that convenience. We did run a survey to find that out. And I've had a chat with most of the marketers in the industry. And they're all like, yes, this is the trend that's going to come next. People are going to want this kind of technology. And our AI is not just in the form of an app. We've even simplified as a web app that the practices could use it on their website. because there's more than 90% drop off on everybody's website without taking action. This could be a great tool to add value to your patients even before they know you.
I
Right?
love that, because what's one of the challenges as well? What do you do with your website to help make people so engaged they want to stick on that website rather than jumping off? I think the average is just the number of seconds that they hang around on your website for.
We found out it's less than 4.7 seconds.
Oh, terrible.
And most of them, to be honest, 95% of them leave without any action on your website, and you've been paying Google ads, you've been doing the SEOs to get all the traffic into your website, and you don't have a tool there to add value to them.
That's it.
Right? This is just that economical, accessible, scalable tool that you could use across your practices. And being a dentist and a practice owner myself, I've made sure it's priced economically for a general dental population.
Oh, fantastic.
So that it can be readily available for them as well.
That is fantastic. We'll talk about the pricing. I want to, first of all, though, so dental practices can start to get into their heads, how could we apply this? You think about all of the communications that you are currently having with patients in your clinical chair or in your clinical surgery that could be done over virtual consultation. I mean, for a start, let's presume that we are tackling the group of patients that may be afraid to come in, or they feel they've got a concern, or they're wanting to search for a practice to go and find, and they're finding this lovely engagement tool, and they can send off their scan to the dentist, and you can say, yeah, that looks like to be an ulcer, or that looks, yes, it's right. It looks like you do have a bit of decay. I do encourage you to come in for a dental checkup. But all of the other stuff, once we've had a patient in the chair and we have done an examination, presented a treatment plan, there's a really big full stop at the end of that. And if the patient leaves and has questions, we only find out about that if they are truly engaged and they ring us and they say, I've got questions, or if we end up calling them for incomplete treatment follow-up and they go, I've still got questions. But these virtual consultations could really pad out that treatment plan presentation and properly service that patient so they're getting a chance to have all the information. You're helping them through search and evaluation of all the data so they can actually make an informed decision at the end.
And they are engaged all throughout because they are the ones taking the photos, they are evaluating, they've already got an AI assessment. When the dentist then reinforces it, yes, they do need it, then the dentist got an opportunity then and there to answer any of their questions. Usually what happens is they walk into the dentist, don't know what's happening, then the dentist is trying to educate them. They're hesitant to accept it because they don't know, they have not seen it for themselves. Dentist is showing it to them, right?
Yeah.
And then they don't return back to ask those questions or for treatment, and you've lost an opportunity. With virtual care, you can then move it to virtual care and use that face to face as a chance to answer those questions and actually get a tick on your treatment plan, because you have a very educated patient there by then, very engaged patient, and they're involved in the process. Usually what happens is you take the photos, you take the x-rays, the patient is already in the chair like that, already nervous. And in that nervous state of mind, that's not the best place for them to visualize and digest all those facts which they did not even know existed.
That's for sure. One of the things that I remember as a patient coordinator back many moons ago, we used to encourage, and we'd have the big, initial examination, and then for the cases that had quite a bit of data to share about their treatment plan, we would encourage the patient to come back on a separate appointment time and bring their spouse or their partner, their other significant person in their life that has financial decision-making ability, to come along as well, because that's where the gap is sometimes. We can very intelligently discuss everything the patient needs to the patient, but can the patient then do the same to the partner who has got 50-50 say in where the money goes in the household? And that's always going to be an enormous gap. With the virtual consultations, the virtual care, all of a sudden you can have as many people there in the consultation as you need. But have you also got the ability to record it so they can refresh their memory a month or two down the track when they've kind of forgotten, they've lost the sense of importance and urgency over it, but then it starts to pick up again?
We're getting there with that recording as well. We're trying to get in. We are right now very asynchronous. We're getting the synchronous telehealth integration as well in the next couple of months. And that's the beauty of it. Uh, we can have them all together in one room. They've not left home, so there's no extra cost added to them. To move, to leave their work early, or disrupt their lifestyle with picking up the kids. They can have themselves and their partner in one room, and it's a lot of saving for the dentist as well, because it saves a lot of their clinical time. This can all be done in their non-clinical time with their clinical coordinator, rather than somebody walks in, takes a chair space where you're just sitting and discussing something.
That's it. And that chair space, that crucial chair space, that has got a filling or a crown going on instead, rather than just for a discussion that can be relocated to another venue, which is online.
Absolutely. And a lot of things I see in the dental practice, that the patient comes in, fills in the forms, the receptionist scans those forms, saves it, then puts it into the patient file. I see that a lot of times. Of course, there's a lot of e-forms, but you have to still send it to the patient. How about you have it on the app? They just update it before they come in, and they get sent a message, oh, you can come in now. It can all
Fantastic.
be done through our app, right? So it's just easy. I went into radiology last few months. I've had a few scans. Every time I went in, they gave me the same medical history form to fill in from top to bottom. I'm thinking, I came here a month back. What would have changed, right? So that's when we came up with the digital forms. I said, you know what? 90% is pretty much the same. Whatever I need to update, I update it there, and it goes as a PDF. How easy is that? The girls love it. It saves them 3 minutes, right? It
Absolutely.
saves them sending out reminders for it. And it's easy to send them a chat message.
Yes, I was going to say, then all of a sudden you've got this ongoing communication that you can have with the patients as
All in
well,
one place,
all in one place.
all on an encrypted TGA approved platform.
Just tremendous, tremendous. And you've got listed there as well contactless check-ins. And so if you're in an area where due to COVID, you've got all the patients turning up and calling you from the car park saying they're here, we can also use the contactless check-in for those sort of situations as well.
Absolutely, absolutely. And right now, because of COVID and the lockdowns, a lot of our practices are loving it. They're seeing, look, it takes a bit of a time when you're bringing in something new. It takes a bit of a time for any staff member or staff members to get used to it. But once you start using something, they realize how much time it saves, how much energy is saved, and where that energy could be used for patient experience than doing the repetitive tasks.
Absolutely. And I think there have always been ways of automating, such as SMSs for appointment confirmations, where I've always thought to myself, yes, it's more efficient, but is it providing as much value as before when you're on the phone with somebody? Oh, hi there, Padma. So lovely to speak with you. Double checking everything's okay for tomorrow. So looking forward to seeing you. So you get this lovely, friendly, remember how great we are kind of communication, as opposed to the very efficient but disengaging text. What you're talking about moving into is actually, if I could use another example of the patient hasn't accepted the treatment plan yet, let's send out a letter detailing all the information again. Again, that's got a certain level of engagement, but how much better if that's done as a virtual consultation online?
Absolutely. And look, because the patient gets to see their intraoral photographs, their possibilities then and there, they're educated better that the dentist is not trying to sell me something. I definitely have a problem. And it's not about AI getting it 100% right. Our job is to get the patient. I believe Smilo.ai's job is just to get the patient curious. That's what the AI is supposed to do. AI is not there as a diagnostic tool. So the dentists never need to be threatened by that
Mm,
AI is going to take over their place.
mm.
AI can't do that 100% without the assistance of the dentist. It can only be a decision making tool. That's all.
And the AI is just providing that link between the patient that hasn't turned up for an opinion to turn up for that opinion.
Yeah, look, a lot of them send out. Even we did it, right? I know you. Even you guys probably did it. If a patient did not turn up to the practice for their checkup and clean in 18 months, you send them out a letter that, oh, you've not visited the practice for your checkup and clean. And a lot of times, patients read that and feel guilty about. How about you say, look, we understand life gets in the way of everything. You've not got in. How about you do a quick check and send us a report, and we'll tell you if everything is okay.
Oh gosh, that sounds fantastic. And
You're
a lot
not
of them would do it
judging
just out of
them.
curiosity as well. Like, what's this new tool?
I know you're not judging them. You're trying to be compassionate. Trying to understand them. Look, pre-pandemic, not everybody was into social media and digital marketing. Now, with the pandemic, every competitor in your suburb is into it,
Yeah. Yeah.
right? The way you're going to distinguish yourself or stand out is through some kind of an innovative tool that benefits and adds value to your patients and giving them the best patient experience outside the practice as well as inside the practice. So you need your girls to be totally attentive and do that when they are inside the practice, and you need these digital tools to do that when they are outside the practice. So having
One.
that blend is very important.
Yeah, yeah. And I love that you use the term patient experience, because that I use that term possibly 20 times every day, because that's what we're attempting to do. A successful dental practice is very mindful about what the best patient experience they can deliver is. But it's
Absolutely.
always been within the four walls, but let's expand that out. Let's blow the walls out and deliver them a patient experience with your practice that's beyond the walls, that's inside their home, inside their work, while they're going out for a walk, that they are still able to interact with you on a very meaningful basis.
Absolutely. That's the whole thing. Like as a dentist, we are trained to do beautiful restorations, beautiful fillings, give a painless experience and things like that, right? But we forget that that is only about 20% of patient experience. The rest 80% is about convenience, is around building that trust, by giving patient the control. And the way we always give control is getting them to choose stuff. We have to educate them so that they make a much more better decision for themselves, a long-term decision for themselves. In the room, you've got 10 minutes, you're explaining different things, pros and cons. They've not even got time to assess it. So having them educated, having them more curious will make them more attentive. And that saves a lot of your time within the surgery, so that instead of 10 minutes, you can spend 20 minutes with their patients on their option.
Wonderful.
That's what is going to be productive and efficient to you as a dentist, because you get to make the money or bill the patient up for the work you actually put in and you do it, right?
Yeah.
And that's how your practice is going to grow.
Yeah. Yeah, that's for sure. That's for sure. And through the research of Smilo AI, of course, start considering these other groups, people who financially cannot afford to come in on a regular basis. Maybe their geographic location has them outside of where it's easy to actually come on in for their treatment assessments. Pressing health needs, maybe they're incapacitated to a certain degree at home. Maybe they have very poor oral health literacy. Maybe there's a language or cultural barrier. Shortage of dental providers in a certain community, and of course the pandemic as well. There's a lot of reasons why people won't be turning up eagerly just to get that checkup done.
Absolutely. And that's where we've seen the gap. We've seen the gap in rural and regional areas. We've seen the gap in mobile dentistry vans, whether it's school or aged care. Also, we've seen a huge gap within the disadvantaged communities, as well as low socioeconomic as well. So this is going to be that tool that is going to help them educate themselves, seek that early intervention. The problem is people leave it till it is too late. They think dentistry is what is that, unaffordable. You just have to take a first step, and that the first step we're going to make it so easy for you, so low cost for you, that that should not come as a barrier. And when you take that first step, The rest just falls into place. You realize the importance of it. And dentistry is not just about teeth and gums and restorations. Dentistry is about good nutrition. Dentistry is about overall general health and mental health. It's all about confidence. So dentistry, if you just treat it as teeth and gums, it's of no use. You have to treat it as a whole body and a useful tool for your day-to-day life. Imagine yourself not being able to chew or eat your favorite food, not being able to smile and, carry yourself in the society. So dentistry is that vital in your day-to-day life.
Absolutely. Gosh. And, I've always been intrigued. There has been so much research and study done to build that connection between oral health and systemic health. Yet I still have failed to see any kind of substantial referral base of patients from GPs saying my patient has just been diagnosed with diabetes. They need to get their mouths in order. They've just had a stroke. They need to get their mouths in order. They've just been put onto bisphosphonates. They need to get things in order. So where are these referrals coming? Why aren't they coming through from GPs? But again, these kind of virtual consultations, virtual assessments can really put the patients in the picture. You don't even need to have a formal checkup to educate the patient around that link and how important it is to maintain their oral health. So let's go ahead and actually make some formal appointment times for you.
Absolutely. And that's why we want to roll out Smilo.ai, not just in the dental industry. We want to keep it accessible through the GP system. We want to keep it accessible through the hospital system as well, where it can be used as not just as a pre-screening tool, but also an education tool, whether you are in the aged care sector and you're a nurse there, whether you are in the hospital ED, whether you are a general practitioner, practicing holistic health. So we want to use Smilo as an education tool that they can give to their patients as well. So we are not just stuck to dental industry.
Fantastic.
And it can be a bridge. Yeah, it can be a bridge.
Yeah. And patients get access to all this crucial information around their health so freely. And it really feels like they have a right to be able to freely access information around their health.
Absolutely. And look, I don't remember how my teeth looked 3 years back. I'm sure I'm grinding more since it is winter now. As we are all aging, there's a bit of abrasion and attrition that happens. So I want to know how my teeth looked 5 years back. There's no proper record for it.
Yeah.
Right. And most of the records are kept at the dentist, which the patients don't have fully access to. So my way or the way I visualized it was Smilo.ai can be that tool where it can be used for comparative and competitive studies as well by the universities and people themselves.
Fantastic.
To see how their oral health has been degrading or improving.
We do forget.
Yeah, look, our users have given us different feedback, right? Younger, less than 25-year-olds have said their brushing and the way they care for their oral health has gone up considerably because now they can see where they've not cleaned, what's going on, and how something is progressing. So that feedback, our older age group, they find it easy to use. It's not that hard because of the selfie culture. They are like, okay, this is just helping me monitor if I'm on diabetes. Most of our patients were diabetic. So it's just given them a chance to monitor their oral health from home. So
Amazing. So tell me a little bit about the journey. So if a practice said, yeah, let's get on with Smilo AI, what does the journey look like to implementing it within their practice?
Look, over the last 6 months, we've learned a lot of lessons, and now we have a little bit more sophisticated onboarding journey. So we give them options of two products. One is their web app. It's pretty much, it takes 15 minutes to put it on their website. Our onboarding team helps them, provides them all the training, as well as all the digital assets, and checks on them every week. So that's one way where patients can, when your patients come into your website, they can do a virtual scan themselves and find out, and all that report definitely comes to you as well as the practice. The second is we give them an exclusive QR code for their patients And this is exclusive to the practice. We don't have access to any of those data. It is their practices patients who can access that QR code and download the app, the Smilo.ai app, and all the reports go to the patient, whether it's their medical history form, whether it is their virtual consults, their chats, all go to the practice. So it is done in 2 stages. In the first week, we do the web app onboarding, and post that in a week's time, we do the app onboarding. We also provide them with a dashboard tool to keep on top of their SMS and email marketing and their dashboard analytics.
You provide a lot of support. And, I'm pleased that you do, because for a lot of people who are older like me, it's a
No, you
stretch.
don't. You don't look like that.
You're very good. You're very, very good.
Well, did you start working in the dental industry when you're 6?
Yeah, that's right. Exactly. Because it is a stretch to the brain to say, oh God, and long ago I decided I don't need to understand how everything works to have an appreciation for it and actually start to use it myself. And I think this is one of those areas that people can have that perception around. And so you do provide a lot of support, which is absolutely tremendous. The communications, you were talking about the SMS and email marketing, with all of that, is that all easy to do from the practice perspective?
Yes, it's very easy to do. It's customizable. We've kept it very easy. Look, we just started with an idea of AI. AI, it was not supposed to be where it is today. I started like, let's see what happens with AI, right? And the pandemic just fast forwarded things. And every product, it started as a simple iOS app that moved into an Android app, then building the dashboard, then people asking for the web version of it. Every product that has come in has been designed with dentist feedback, with the use of how it is going to be used in the dental practices from practice managers. So in the last 6-8 months, we've worked extensively, not in expanding our business, but in getting the workflow better and better and better, so that when we're ready for commercialization, which is now, we can do the onboarding quicker, we can give them the experience they want. So I have to thank my early beta testers who have been super patient with us and have helped us define that experience for every practice. So it's super easy to use. It's like Facebook. The navigation is super easy as well.
Fantastic. And what's the kind of feedback you've been getting by your users of the application?
See, the first and foremost is I think it's easy to use, and our customer support has been excellent. If they report a problem, we turn around within 24 to 48 hours. If it is not a major change, if it's just something small, we do get back within 24 hours. If there's any change or a code change, we do take about 3 days for that. I think that's the best feedback we've got, considering the customer support experience most of the practices I've had. The other feedback is from one of our early adopters. He said one patient accepted my Invisalign treatment plan. The product paid off for itself.
I love it.
That's it, right? Our practices have been getting at least 3 to 5 new qualified leads per month. And we don't charge based on use. You can have 400 people use it. Our cost doesn't change. So it's super affordable.
Fantastic. And talking about the price, are you happy to share the price of the product?
Yeah. Right now, until the end of the year, we do have a special pricing for the widget at $299 a month. And of course, we have the widget, the CRM, and the app as a total bundle for $599 a month.
Fantastic. And I can certainly see how that can convert and get a pretty quick return on investment when you are building out your communications so elegantly with your patients that they feel more ready now than ever before to actually make a decision, especially with things that may be a little bit more complex.
Yeah, and look, they are at home. Give them the power. And it's about we are collecting a lot of information from the patient anyways about their oral hygiene habits, their oral health, their medical history form. It will probably give you a better picture of your own patient, which you had not seen before, and the curiosity they have about their own oral health. Rather than telling, get them to ask you.
Yeah. Yeah.
We've
I
been teaching communication to dentists for a long time, but how about you give the power back to the patient?
Magnificent. And I'd suggest possibly a good way of getting the team aware and are comfortable with the process is we've all got those handful of patients that, love us so much that, if the compressor broke down one day, they're like, oh, don't worry, I'll come back another day. Or if there's little minor hiccups, you can be rest assured that you can fall back on that relationship and they'll still be there for you. That kind of client would be great to say, hey, we're looking at introducing this new thing to our practice. We would love for you to interact with us through this new application and let us know what your experience is and give us a chance to give it a try as well. And then that's a great way of the whole team in a very open way going, is this going to work for our patient base? Is this going to work for our practice? And where are the opportunities within it that we can actually build our practice?
Absolutely. Look, when practice management softwares came into existence 10, 15 years back, there was a hesitancy of moving from paper to, web, right? And now you're moving from web to cloud. There is a hesitancy there. And now from cloud to AI. There is a transition that is happening, right, within the dental industry itself. And AI is used in multiple areas, whether it is, scanning your documents, scanning your medical history forms, whether it is your treatment evaluation. There's a lot of artificial intelligence that is being used at the moment. And there's a buzzword, to be honest. But with Smilo.ai, we just want to be your patient management, software. We want to be that patient-facing product from your practice.
Yeah.
And connect with your patients at every contact point, whether it's the website, your social media, or any other SMS or email marketing that goes from your practice. So that's where Smilo.ai is a great engagement tool.
Fantastic, fantastic. Well, people can go and find out more by following the links within the show notes, but it is Smilo, SMILO.ai.
Yes, of course.
And in there is an area where you can go to if you're a dental practice and look at information there, and also jump into the patient area too and have a little look there so you can see from the patient's perspective how AI can help them as well. And if people want to have specific questions, I know that you've also got they can organise a demonstration of Smilo.ai as well. Is that all through the website?
Yes, they can do it through the website, or they can contact me. I'm available on Facebook, LinkedIn, Instagram, and Twitter. They can leave me a message and we'll book in a demo for them.
Fantastic. I'll make sure those links are in the show notes as well. Thank you so much, Padma. I do hope you come back on again for a couple of reasons. One, we'll talk about teams and recruitment.
Yes, sure. Why not?
Performance reviews. But also, as the journey goes with Smilo.ai, come back on so we can continue to share the ways, the opportunities that this particular application has in the growth of your dental practice.
Absolutely. Thanks, Julie. Thanks for having me. It's been a great chat, and I would love to come back to talk about teams and the growth of Smilo.ai.
Fantastic. Thank you. Bye-bye. Hey, if you enjoyed listening to this episode, you should join the club. The club members receive an online lunch and learn every week where I share insights, systems, and strategies to improve the success of your practice. These lunch and learns could not be easier. They are recording so you can watch them at a time that suit you. Members also have full access to the library of all of our past topics. The price is just $199 per month, and it is a powerful and effective way to upskill your team. I hope to see you there.